My name is Melody. This is week 3 of my clinical reflection. One way my nursing care skills expanded this week is by reviewing laboratory values pertinent to my patient's illness. I make sure to review the patient's lab values at the start of the day and every time after there is a new lab drawn. For example, if it is a new kidney transplant patient, I make sure to monitor their creatinine, BUN, white blood cells, and H&H. Another way my nursing skills expanded are by reviewing clinical notes from physicians, case managers, or nurses. By reviewing these clinical notes, I can read the patient's history and physical, what the plan of care is, or what complications occurred for a longer admission. My nursing care skills also expanded through organizing my work list. I have begun to utilize the whiteboard in the patient's room to write down pain medication schedules or drainage schedules, which help to remind me when certain tasks need to be completed. One thing I would do differently would be to make sure there are enough people with me to move an obese patient in bed. The patient's caregiver and I were able to move him once together with the bed in Trendelenburg position, but to be safe and prevent injury to our backs, we should have at least 3 people to move a heavy patient. Another thing I would do differently would be to set alarms for myself because things can get busy and I would forget to follow up on IV bags or post-intervention assessments. Another thing I would do differently is giving myself enough time to research the patient's situation prior to the start of my shift. Additional knowledge I need when encountering these situations in the future are more experience and more time working on the same floor to acclimate myself. I feel more confident this week more than the other times because I am practicing my skills more consistently. One key behavior that has expanded is clinical reasoning by initiating a plan of care for the full patient assignment based on clinical judgment and evaluation. After receiving a report from the night nurse, I will review all of my patients' chart and evaluate which one to see first by acuity. I base this decision on whether they are a fresh transplant patient, how many days post-op, or what complications they are having. One key behavior that needs improvement is clinical reasoning by anticipating and responding appropriately to undesired patient care outcomes, using evidence to prevent those outcomes. I want to improve on thinking ahead about what complications a patient may develop and be prepared with an intervention if such complications may occur.